Good morning, everyone. My name is Kristian Steen Frederiksen, and I will be presenting on behalf of the EAN Dementia and Cognitive Disorders Scientific Panel in relation to this workshop on e-brains and the Human Brain Project. I would like to start by thanking the organizers for organizing this wonderful and important workshop in an area that I think has great potential. I would also like to thank the organizers for inviting the panel that I co-chair. So apart from being co-chair, I am also a neurologist and I'm based at the Danish Dementia Research Center in Copenhagen, Denmark. So I would just like to take a moment to go into a bit of detail about the EAN Dementia and Cognitive Disorders Scientific Panel. So as I've already said, I am the co-chair of the panel, and I co-chair the panel together with Professor Flavio Nobili from Genoa, Italy. As with other EAN scientific panels, we are part of a management group where we are a total of 7 members, including myself and my co-chair. The whole panel has approximately 96 members, so I think we're quite a large panel. And we have a close collaboration with the research and resident fellow section of the EAN, as well as other junior EAN members. We have a number of partnerships, specifically with Alzheimer Europe and the Asian Oceanic Association of Neurology. And we are very happy to have these partnerships, and especially the partnership with Alzheimer Europe, which means that we have a patient representative within the management group. I think this is extremely important when it comes to dementia. We have the ability to give patients who are in a vulnerable position a voice of their own, and that's truly wonderful. I just want to briefly go into a bit of background with regards to some of the activities that the EAN Dementia and Cognitive Disorders Scientific Panel has had over the years, specifically with regards to producing guidelines and position papers and reviews on relevant topics, which the panel has done for a number of years, even before the EAN became the EAN. And we have continued to do this across the recent years. And I will come back to this topic a bit later on in my talk. So as I said, it's a great pleasure to have been invited here to talk on behalf of the EAN Dementia and Cognitive Disorders Scientific Panel. And of course, given the fact that there is an MIP Federation on Dementia, it makes a lot of sense that we have been invited to give a brief talk today at the workshop. And I've just done a screenshot here to highlight that the data that is currently federated in the MIP with regards to dementia is highly relevant, spanning from imaging data, data on diagnosis, neuropsychology, demographics, and genetics and proteomics. And I think that this really shows the potential with regards to e-brains and data access. So on the next couple of slides, I have I will present some of the challenges that are in the dementia field, and there are many, of course, as there are in many other areas of neurology. And I think that some of these, or all of these challenges, are some where the eBrain's setup can be instrumental in providing solutions. So, as you will know, the population across the globe, not only in developed countries, is an aging population. And despite a decrease in the incidence of dementia, the aging population will lead to more cases of dementia in total. And this puts a strain on healthcare systems, not only in terms of hands, people that will need to be employed in caring for patients with dementia, but obviously also the costs associated with this. And this calls for innovative solutions. It's also clear that developments in the field require that we are able to give very accurate diagnoses, and diagnoses that are based on the molecular and pathophysiological processes and molecules involved in the specific pathophysiology in the dementia disorders. This is important for many reasons, but certainly if we hope to develop disease-modifying therapies that are likely to target very specific processes in the pathophysiological process. Moreover, we need to improve the ability to make earlier diagnoses, again for a number of reasons, but specifically for the hopeful situation where we'll have a disease-modifying therapy, and where we must assume that being able to diagnose the dementia disorder at an early stage is very important for the drugs being effective. This also needs to be done in a cost-effective way. As I said on the previous slides, we will see many more cases with dementia, and if we see a disease-modifying therapy being introduced into the clinic, the need for diagnosis will also be greater, and therefore we need to develop cheaper ways of diagnosing accurately. Prognostic biomarkers will also become important and are already needed because it is very difficult at the present moment to predict for the individual patient what the disease course and disease trajectory will be. We know that for most neurodegenerative dementia disorders, the disease trajectory varies greatly between patients, and many patients ask how will they be in 1 or 2 or 3 years, and this is something that is at the present moment difficult to answer for the patients. For Alzheimer's disease, we are moving ever closer to a disease-modifying therapy. As you will probably know, a disease-modifying, or at least purportedly disease-modifying therapy has been approved in the US for Alzheimer's disease. I'm talking about aducanumab or Aduhelm. And we are still waiting to see what the EMA are going to decide on this matter in Europe. But I think that if this disease-modifying therapy is not approved, then within a short number of years, we will see disease-modifying therapy for example, Alzheimer's disease being approved. And this will have huge impact for diagnostics in dementia, which will put even more even greater strain on the healthcare systems, because there will be a need for early and very accurate diagnoses, and there will be a huge um, a pressure from patients and so forth for early and accurate diagnosis. And there will also be a need for follow-up, and that we can effectively track the disease and effectively evaluate whether disease-modifying therapy has effect in a much greater detail and much more precisely than we are able to at the present moment. Now, for many of these things, I've had in mind Alzheimer's disease, because this is the disease that we know the best, but there are a lot of large or big prevalent neurodegenerative dementia disorders, such as Lewy body dementia, where we know much less in terms of pathophysiology, in terms of the biomarkers we have available, and in terms of understanding of, for example, the early phases of the disease. And of course, we also need to develop drug therapies for Alzheimer's disease and the other dementia disorders. And I think that for these challenges, the e-brains can play a major and pivotal role. We need large data sets to enable accurate diagnoses, to enable to be able to produce valid and reproducible research, and therefore e-brains is of great importance. So what may be the role of the EAN Dementia and Cognitive Disorders Scientific Panel in relation to e-brains? Well, I think that we will be able to help by raising the awareness of e-brains as such amongst panel members. So making them aware that they are able to access and use a large repository of anonymized data for research purposes, and also that they're able to contribute in terms of data as a partner to the e-brains data repository and making the repository even larger. And of course, I think we should also work to increase the awareness of other data sharing initiatives and other larger pan-European databases. I think it would also be useful if we could provide information and make panel members aware of relevant funding calls to enable panel members to raise funds for research which could be based in e-brains data. And I think we could also serve to connect potential panel members as consortium members, which may be difficult. And there might be a number of other ways we might be able to serve the community and our panel members in relation to e-brains and so forth. I think in terms of leading scientific projects or calls, we at least at the present moment in the panel not at a place where I think this will be possible. But perhaps in the future, with the right support and the right infrastructure, it may also be something that the Dementia Scientific Panel might be able to do. One thing would perhaps be to consider doing this in connection with other EAN panels, such as, for example, the higher cortical cognitive functions panel or the neuroimaging panel, but that's just some thoughts. So with these words, I would like to wrap up my presentation, and thank you for your attention. I believe that I'll be cutting my talk a bit short here, but that would leave more time for discussion on this interesting area, I think. thank you once again for your attention.